Okay, guys, today I'm gonna tell you about Scalp. It's gonna be a very brief overview. We'll start off with the boundaries. Interiorly, it is bounded with supraorbital margins of the frontal bone. Laterally, we have the temporal bone, zygomatic bone, and temporal fascia. Posteriorly, it is bounded with occipital bone. Very simple. Now, if we talk about the layers of the scalp, it is in the name, that is S for skin, C for connective tissue, A for aponeurosis, L for loose areolar tissue, and P for perineurium or periosteum, which is the bone. The thing which you have to remember for MCQ point of view is that the danger area is the fourth layer of the scalp, which is the loose areolar tissue, because it contains the emissary veins from which the infection can spread to the meninges and meningitis can be caused. If we talk about the innervation of scalp, the cutaneous innervation is done posteriorly by greater and lesser occipital nerves, interiorly by supraorbital and supratrochlear nerves, which are the branches of trigeminal nerve, and laterally by zygomaticotemporal and auriculotemporal nerves. If we talk about the vascular supply, the arterial supply is provided by external and internal carotid artery. However, we need to memorize that giant cell arteritis is a condition which is caused by superficial temporal artery. If we talk about the path of the vascular supply, the internal carotid artery goes through the carotid canal through cavernous sinus and gives off its branches, which are supraorbital and supratrochlear branch. And we need to know that anastomosis is any connection between adjacent arteries. Now, what happens in case of a scalp laceration, which occurs whenever there is a road traffic accident or any injury to the head or any other mishap? It is a dangerous situation because the scalp has a very rich vascular supply, and any laceration can cause bleeding from both sides of the vessel. That is like this. And if there is bleeding from both sides of the vessel, it can lead to blood loss, which can further lead to shock and other medical conditions. So these were very short points and a very superficial overview regarding scalp. And yeah, that is it.